Cortez Masto.
Thank you. And for the benefit of the committee, the adopting an integrated care model is so important, and that's why Senator Cornyn and I, because of our work here together on this committee, have introduced the Complete Care Act. Welcome you to join us on that, and what it does is expand access to behavioral health services delivered in the primary care setting by helping those providers with the upfront cost of adopting that integrated care model. That's a first step. That's for behavioral health. I suspect and hope that the same integrated model would work for substance use disorder. And you guys are all talking my language because this is the conversation I have in my state. The lack of continuum of care, the challenges we have with the workforce, the stigma associated with behavioral health and substance abuse issues, and this idea that in the United States, what should be happening is that if you have a physical issue or a mental health issue or substance abuse disorder, you should be able to go to a doctor, access that care no matter what it is, be able to afford it, have quality care, and get that support without the stigma, without the silos of how am I going to pay for it. That is our challenge in this country. And the work that you are all doing and the advocacy is going to help us, at least at the federal level, start filling in the gaps in that continuum of care and hopefully overcome this stigma for so many reasons. And so that's why I appreciate the committee and the work that everybody is doing. The other thing I've learned from at least the folks in Nevada, that peer support specialists are key. And I've met so many of them, right? And this makes the difference as well. And so Senator Cassidy and I introduced the Peers in Medicare Act. And again, it's legislation that would expand coverage of peer support services so that people with Medicare can access the care they need. So I guess for all of you, maybe Dr. Christine, let me start with you. Talk a little bit about why this is crucial. Why we have peer support specialists. Why is it important to integrate this into part of this services for individuals?
Thank you, Senator, for that question. Peer support specialists are crucial to our treatment. These individuals are often the single person on our team that can connect with patients that are especially hard to reach and patients that may have experienced the most stigma in our medical settings to begin with. And so as somebody with lived experience who's been in their shoes, that is really inviting the patient in to treatment in a way that simply those of us without that lived experience can't always do.
And that's true for adults and our youth, correct?
Yeah, I think that is. I think it's true for youth as well. I think you have to be thoughtful about creating systems where youth who are doing that work as peers are supported because they're younger, and so it would look differently. But that credibility and that I think about the way that the patients like sigh and relax when they are able to talk to someone who sort of understands what is going on, and that's like a human thing. Right. And so it just sort of seems like rational then we would have people as part of our teams who would be able to offer that as like a component of the treatment, the care that we are actually offering to people.
One final thing, and we haven't touched on, and would like any of you just to weigh in on this. It's maternal health care. Many pregnant, postpartum women with substance use disorders face barriers that may affect their treatment to services. So I would ask any of you to weigh in. Are there services or treatment strategies that we should be talking about as it pertains to maternal care as well? Is there a uniqueness around that we're not aware of, that we're lacking in our continuum of care here? And Dr. Soliner?
I'd be happy to offer some comments. I'm sure the other panelists have some as well. I think it's important to emphasize, first of all, that for pregnant people, medications for opioid use disorder are effective. And there has historically been a lot of stigma about starting people in pregnancy on medications. And I think a lot of it has to do with this unfortunate narrative that we can have babies that are born with addiction. And that's just absolutely not correct medically or scientifically. There is a syndrome called neonatal abstinence syndrome. It's very easy to manage. I don't know if it's very easy, but it's manageable clinically, and it puts mom and baby on the right track. So I think making sure that the same interventions that we're recommending for everyone else are offered to pregnant people is really one critical piece of the puzzle around pregnancy.
And is there a barrier to affordability through Medicare or Medicaid because?
I would say that Medicaid has been a terrific system for pregnant people. I think that it's important that we recognize that Medicaid expansion is catching more people during pregnancy and taking steps to ensure that people maintain their Medicaid coverage during that incredibly vulnerable period of time. So I would just say that Medicaid is a major part of that solution.
And it is in Nevada, believe me, we've just extended it. So thank you. Thank you, Mr. Chairman.
Senator Stabenow.
Well, thank you